Okay, so let's start with our agenda. Okay, so of course, if you have any questions at all during the presentation, feel free to unmute and talk freely as you'd like. You can also drop questions in the chat and I will check that as well. Itinerant staff, if you have anything to add, please let me know. Today we do have a presentation from our audiologist, Sarah, on OAEs, and we're also getting those calibrated on the 7th, so that will be an awesome presentation from her. So to start out, it is COSIF season right now. Your part for now is finished, and I thank you, and Angela, our data coordinator, thanks you for making sure that everything was finalized and put in correctly. Already we are seeing a difference from last year as far as our data poll on available information, which is fantastic and totally due to your efforts. So thank you so much for that. With that, you can expect in about the next week or so to receive a spreadsheet from me if you have errors. Just like last year, it's going to show you which student. We do the best we can to fill in information that's actually on your form, but for some reason wasn't pulled by MDE. However, if you do get a spreadsheet from me, that just means that you have to go in and answer a couple more things. For us, that is usually the yes or no questions. Those are at the bottom of the page and they're most commonly missed. It's not just our member districts, but I always remind you on those. And so again, I just do it out of habit to remember to check the yes or no questions on your COSIFs. As a reminder, if you have not served a child more than 6 months, you don't have to fill out the COSIF. And then other than that, our data is due like mid-December, kind of right before break. So Angela and I are going through that information now. You'll get it, and then I'll just give you some reminders depending on if you need some extra information and when we can get that back. Does anyone have any questions on COSIFs? All right. So the next thing we're covering is the American Rescue Plan Part C grant. So this is kind of an exciting thing that I applied for last year. We were granted money basically to increase the awareness and use of culturally responsive teaching strategies, which hopefully then increases our parent communication for Part C. So this money was offered to everyone. We were all highly encouraged to write some type of grant. Thousands and thousands of dollars were given out to schools. We received $6,000. So basically, we have a couple pieces to this grant that I'm going to be executing throughout the year. It's not going to be too much work for you because a lot of this will just be embedded in things we already do, like network meetings, the surveys that I send out regarding network meetings, or to get your feedback on different things is where we're going to see most of this grant executed. So the big theme along with the state this year is the successful learner equation. And what that is to say that it is not the responsibility of a child to be ready for school. It's the responsibility of adults and programs and our systems to be ready to support children. So this grant is basically just going to give us an opportunity to learn some more strategies that would help us to connect more to our families in a way that's relevant to them so that the learning experience is even better for our kids. I know when I wrote this grant, it was at a time where we talked a lot about the families we were not making connections with or the ones who were kind of dropping off altogether. So this is going to be a different way for us to try and connect and still see the children that we're maybe not able to connect with on all of these referrals or even after we evaluate. So the first part of this grant is a book supplement. So for anyone who is doing something with Part C, you are going to receive the Culturally Responsive Teaching and the Brain Book, which is by Zetta Hammond. What's really nice about this is you'll have the book, but every week I will be sending out just a quick chapter highlight of those things that we're learning or maybe trying to implement. The next one is data collection. So every quarter, there will be about a 5-minute survey. And this will happen along with our ECSE survey, so I can still get the dates and times that we want to meet. And basically, it just covers what your current understanding of cultural responsive teaching is. And I share it with MDE at the end. You know, showing growth really is our goal. And in any learning experience, we usually do show growth. So you're encouraged to share family experiences, just helping MDE to understand, you know, how we're doing in our member districts, what I can do to help you to connect with families, and things of that nature. Next is a personal development part. We will be having an opportunity, hopefully for a couple of people, if you'd like to attend workshops on this. This could be virtually or in person, but we did get granted some money for the fee for it, as well as some sub-pay. So that's something that we'll explore after the next break. Next is to strengthen our interagency ties. So what I would like to do with this, in our first survey, I'm going to have you identify groups that we use for resources for our families, or maybe common referral sources. One that comes to mind for me is when we look at county social workers, we're often getting Help Me Grow referrals that have very little information, and then we have a very hard time getting in contact with the referral source or the parents. So hoping to collaborate with some other groups so that we can understand what each other's roles are a little better and help that process for you all get easier when it comes to actually contacting the families and having good information on what we can do for them. Lastly is like a parent university type of opportunity. At the end of our grant, we will be offering Part C families like a goodie bag of different things that we'll collaborate on what we want in that, and also information that we feel our families could use or need. That goes back into our interagency ties. Maybe through this process, we're going to find out about some programs that we aren't commonly using, but understand when a good time is to use them, or some different things to basically help us widen our net with these families, and know that we are one of the primary people as the case manager and in with the family, and how we can get them connected throughout. So that is kind of the rough synopsis of what we're going to be doing for that grant. I want to let you know that the intention with this is certainly not to put more on your plate. If anything, I want to use this grant so that we can understand how to have a bigger group of people to help families, more resources, and take some of that worry off of you, or give you resource lists, or know that we're connected with different people who we can work with that maybe we're not working with now. Does anyone have any questions about that? Okay, well, if you do have questions about it, you can let me know. You will start receiving soon, in the coming weeks, the emails regarding the chapters about the books, and then I will also hand those out to anyone in Part C as I come around in the next 2 months for visits. Our next piece today is attendance and membership. I have talked to all of the member districts at this point on how you are doing attendance and membership input. I've heard from itinerant staff as well who do it different in different member districts. Most of you are using SPED forms right now. However, some of you are using a very handy spreadsheet. And I want to say thank you to the Malacca crew because they have been so helpful in explaining to me how they use this other system and how I can explain it and offer it as something you could do in other districts as well. At this time, it seems that only 2 other districts are going to be using it, which I want you to know is totally fine. MDE does not tell us we have to use SPED forms, spreadsheet, whatever it is, as long as we get the information. And if SPED forms or whatever you're doing is going really well for you, then of course I think that you should stay with it. But if you are exploring a different way to put this information in that generates outside of SPED forms, we do have an example spreadsheet here, which you'll get, as well as an instruction guide with several scenarios on how you report it through a spreadsheet. If you do get curious about this and want to try it out and you're not in a district that is already set to learn this method with me, let's talk about it first so we can make sure whoever is using these numbers at the end of the year is also on board with this method. But you can go ahead and check that out if you are interested, but if not, there's no pressure on it. So looking at resources provided by MDE here, there's a couple of different things I added. All of the links will always be live, so when you get this, you will have them forever and can explore them as you wish. We have the toolkit for healing-centered practices, which is designed for professionals working with families prenatal to age 6. We've also looked at the preschool inclusion toolbox, so that has your placement planning form and the advantages and limitations of those placements. A question that has come up this year is understanding when we are placing a student, whether it's in partial inclusion or maybe we're having them in fully self-contained, how we're making those decisions. Yep, the agenda, Elena, will be sent out to everyone after the meeting, so you'll get everything here. So this would be really helpful for that planning piece when you're working as teams and deciding what are we going to do with that. The next part is knowledge and competency frameworks. There are 3 new versions available on MDE. I know you've heard me say it, you've probably heard your other coordinators say it, but it is hard to find things on MDE. So if you're interested in looking at working with infants and toddlers, working with family child care, and working with preschool-aged children in centers and schools, I would definitely suggest you just use this link as your jump page for it. The next one that I have here is a joint visit planning form. Now, some districts in our region use this, and they have really liked it when they're planning on bringing on another staff member to a home visit. So if it's something you want to explore, you definitely can. What this covers is what you're needing from a joint visitor, what the background information of the family is, conversation, planning, context for the visit, and roles. So basically, it's just to make sure that everyone is on the same page going into the home visit, if that's something you feel like you need, or if there are more than one person going out, this can be a good tool to sit down beforehand and understand how you're going to have the most productive home visit. Next is addressing conflict and co-taught classrooms. To be honest, this is not something I hear much about in our districts, but you may just be fantastic at conflict resolution, or you never have any conflicts, which I hope is the case. But if you do, this article gives you tips on communication, and also it has self and program assessments. Even when there's not conflict that needs to be addressed, I thought the assessments in this were kind of interesting for co-teaching, just because you're able to go through and kind of assess it from your view. You can do that with your co-teaching partner and then go through it together when you're wanting to see where maybe your shared deficits are or your strengths, and do some planning around that. So those are available within that link. Lastly, we have the inbox. Now, MDE has always had an inbox where you have to ask a very specific question about ECSE, and they will point you in the right direction. In our monthly meetings, they cover common questions that are asked multiple times in a month, and I find it so interesting that people ask so many of the same things together kind of on a monthly basis, and it's awesome that MDE then addresses it with us to share. So the first one was, is there a Part B version of the post-referral flowchart like the one for Part C? Yes, there is, and that is Part B 619, post-referral pathways. This can be found on MDE, of course, but I will also link it here just in case that's something that you are in need of or don't already have in your drive. Next is, are all of the requirements related to timelines still applicable given the record number of referrals? Now, I want to say yes, it is, but MDE also acknowledges that we are still having very high referral numbers, and I know in all of the districts you're each feeling it, whether you're on our big districts or in one of our little districts. You are really seeing a lot of referrals. I've heard a lot of children who are age 2 are coming across in some districts, and knowing that those were probably the babies born in COVID that were not referred, and now they're coming back out in need of an evaluation or screening. So no wiggle room on the timelines. I wish there were, because that would be so helpful to you. But do know that everyone in our member districts is really experiencing something similar, and, you know, chatting with each other, chatting with me about it. If there is any way that I can help you, or planning that we can do to make things run more smooth, I would be more than happy to talk about what those possibilities are and help you out with that. Does anyone have any questions on those MDE resources, the inbox, or referrals? All right. So next is MDE for parents. This is usually a really short spot, but sometimes MDE does come out with a few things that they want people to know are available for parents. So this one is the Center for Parents. It's an overview and a question and answer document on early intervention. So if you do have a parent who's asking a lot of questions, you can always refer to this document. It's parent friendly. And if you want to just share it with parents, you could certainly do that too. Of course, I trust that you would know when to use it and if you would need to. So feel free to share that link if necessary. The next piece is the IEIC, and we meet once a quarter. Usually we had our last meeting, but our next one is coming up on Thursday. So with this, one thing that we were finding is we would, of course, put lots of referral data in, but we each have a spreadsheet for the member districts that we fill out, and we have the Help Me Grow number, birth date, age, whether a student qualifies or not, what the outcome is with parent contact. I will be sending you monthly. Now you will get that spreadsheet to update. I know that it can be kind of a pain to be filling all of that information out. I'm sure you have your own SST grids and everything like that. However, this information is so helpful for this group because we are then able to, plan with funds or what referrals are looking like in all of our districts. So I really do appreciate you filling that in. I go ahead and I share that information to a master sheet that is then kept by our IEIC. And then the last thing with that is outcomes of the referral that are closed out for whatever reason. If you would please put in there what happened with the referral, that's also one of the fields that we look at in the data group. So it's helpful to know, are kids qualifying, are parents discontinuing communication with us, and what that looks like. Does anyone have any questions about that? All right. So next is learning opportunities for you. MDE is doing a facilitator training for health-centered practices. This is to increase your knowledge about early care and education policies, practice sharing stories for advocacy, learn how to contact and connect with elected officials for positive change. Next, they are offering an outdoor safety and outdoor learning policies for early care and education settings. So that one's coming up on December 5th. And then lastly is scope. So this is a really great one. I've attended the first few, and it's essentially they're presenting a training series to support infants and children with neonatal abstinence syndrome and opioid withdrawal for families. So they do guest speakers each time who kind of take a different perspective on this. They share their slideshow. They do a family stories portion of it. If you access this link here, you can actually go to sessions that have already happened and watch them at your leisure. I find that really helpful because 3 o'clock on any given day of the week is kind of a time where I feel like IEPs or parent meetings or things like that are happening. So if you are interested in that, the ones that have already happened are in that document. If you would like to sign up for future scope presentations, there are still several left, so you can go ahead and click this link here. Any questions on learning for you?
Marissa, how long would we be able to find previous ones if we choose not to register for new ones?
They should be available for, I think, ever, because honestly, Ashley, they put them up on YouTube, but I think it's a private link to get to it, so okay. I don't picture it disappearing.
Awesome. Thanks.
Yeah, no problem. And I'll keep updating that as the sessions happen, so if you choose not to register, which honestly is completely fine, then we'll just always go back to this access document and you can watch it at any time. They also offer a couple of resources per training as well, like different websites or resources that you might want to use with families. So that's been a cool thing to see that they weren't doing last year. So the next piece here is regional 5-7 updates. So we had our meeting in November and it was in person, which was fantastic. Not that I know really anyone in our region, but it's awesome to get together and hear all of the questions that are coming from other areas and get those answers and talk about things that we all have a different view on or we're doing something different. We have we have 2 PDs who are there with us, Michelle and Jody, and they lead. We also had Danielle Hayden, which is our main ECSE person at MDE, with us in person. So we had a really great conversation. She gave some tips. A big one was how to maximize your money in funds for your programs. And Danielle had said the first big one is free and reduced lunch forms. It is necessary for all enrolled students to fill out a free and reduced lunch form, even if they aren't eating lunch. So I think one thing that people were saying was if a student wasn't eating lunch, or, there was something going on, maybe they were doing home visits still, that they weren't getting those forms filled out. So that is something that you can do to increase revenue. The next one was third-party billing, which of course, is a really big topic from Rum River last year, but even more so this year. We are really trying very hard to increase the amount of consents that we have for students who have MA billable services and bill to get the revenue for that. I was pleasantly surprised to hear how much some of these services actually bring back for revenue. So making sure that we have consent, remembering to ask for that when we're meeting with parents is really important. And then last is MARS. So Danielle was saying that children identified as eligible and receiving services, at least one service is happening prior to December 1 or June 31st can be in the MARS count. I know that you all have methods for putting that in, and I'm sure you're diligent about it. So just know that MARS is also a big revenue for our schools as well. Next, they shared a couple of things for service frequency and related service providers for B3. And this kind of ties into what I was saying earlier as far as deciding what our frequency is going to be or what type of program we're going to have for a student. Each of these links, we have got webinars, supportive materials, we have a couple good articles on this topic. So if you're wondering what's going on with choosing your service frequency or how you could have a better understanding of that, these would be great links to start with that are being used in regions 5 and 7. So as always, if you have any questions or if there are questions that come up frequently for me, if you've all asked me something, I would bring it to 5-7 if we don't necessarily have a very clear answer, or just to find out what other places are doing. So please know that that's always an option to see what's happening elsewhere, and I would be happy to ask. Anytime you think of it, you can just email those to me. Okay, so the home stretch here on me talking, this is good. First, so Rum River staff, now here's the part where we're just talking about things for us, a couple resource things that you may need. The first one is vision for Part C. So this is ages birth to 3. This form is to be completed by early childhood special education teachers and then given to Roz. Roz, are you still on the call?
I am still on the call.
Awesome. Do you want to talk a little about this?
Real quick, I know that I've gotten some questions from case managers in the past, like when do I refer a kid for vision? And Part C, I always say it's easy to take kids for vision for Part C. But this must be a very common question that MDE gets because, ta-da, there's a form. So this is just a quick checklist. If parents have concerns, if you have concerns, if you see any of those medical diagnoses listed when you get paperwork, they'd be the ones that I want to know about. Now, some of them aren't as earth-shattering as others, like nystagmus. I'm not going to be like, oh my gosh, we got to get this kid on. But I still want to know about them. So that's all. Just a quick, easy form. And after you're done filling it out, just take a couple pictures of it and send it to me, or scan it and send it my way. And where are you going to put it, Marissa? Because like you said, MDE is like the black hole for paperwork. You'll never find it. So are we going to
Yes.
put it
It's
like
linked
somewhere?
right here, actually. So I send this agenda out to everyone afterwards, and then they can save it to a drive if they want, or they could just access it right off of this.
Can Zach put it on our webpage?
That's a great idea. Yes. I will write it down. Perfect. Thanks, Roz. All right, the next one is a question about closing the loop letters. We talked about this, maybe a couple of us last year. Someone asked about it again. I have reached out and gotten some different information from MDE, from people around us, and at this time, we are not going to be providing closing the loop letters. I'm not actually sure that any of you have been sending those out. I know when I came into this position, there were templates made, but it may have been more so used coming off of that COVID time. But right now, we've decided that we're not going to ask you to send closing the loop letters. One of the big reasons for this is that we can't share any information with a referral source without having the consent of parents. This includes sending something back to them that says we couldn't make contact, because that's actually still something we need to sign for, which isn't how the closing the loop letter is set up. Aside from that, Help Me Grow does provide referral sources with confirmation numbers. I know that a couple of people have been contacted saying, did anything happen with this? Can we know more about it? And I absolutely appreciate that referral sources want to know that they're being heard, and they definitely are. But at this time, we're not going to be sending closing the loop letters out. If that guidance changes, I'll certainly send them out to you, but our documents aren't updated enough for that either. So if you do have copies of it, please disregard those. Next is our Stand Ready to Serve letters. This link includes 2 letters. We have one that is for contact never made, and then we have one for lost contact after plan was sent. The copies of this can be edited, so you just make a copy of it, and you, I think I have them actually highlighted where you would put your information in and what you would want there. We have looked at our letter compared to letters of other districts and co-ops, so we're all covering the same thing. And just a reminder that you must provide procedural safeguards at any time. There is a prior written notice or change, etc. So make sure if you do send a Stand Ready to Serve letter that you also, in Part C, offer them the procedural safeguards again. So that link is good to go. Again, feel free to save it too. If you put your school's letterhead on it and share it among your teachers, that would be great. So quickly on our website, I will have Zach put on Roz's link. Our page 4, which is just the ECSE page, is actually getting rather full. But we have one new resource on there. It's not new to you. It's the Part C webinar and slides, which have been on there. The actual webinars have. However, we now put on the slides so that you can access, and then if you do Command F or Control F, depending on what your computer is, searching keywords in there, I have answered a lot of questions that have been asked by looking in that document. So if there's something really quick you want to find out that seems to be a question that isn't so interpretive and something that would just be out on MDE, I would suggest heading there first. The information is really clearly explained on each of those slides, and they cover a lot. I think it's 84 slides or so. Of course, I'm always happy to answer questions for you, so please don't hesitate to email me as well, or if you find something and need it to be checked, I can certainly do that too. But it is available. Just quick on OAE meter calibration. We have December 7th is the day. Everyone is scheduled to pick up now. It's either me getting it or your DHH person is going to get your machine and bring it to the co-op. We will then coordinate again to get it back to you. Make sure that you have verified in this sheet here. It's just owner of the screener, and then payment, I believe, is also on there too, who to contact with the bill. Any questions on general Rum River updates? Great. Okay, well, Sarah, take it away.
Okay.
I'm gonna stop sharing. There you go.
All right, can you guys see my slideshow?
Yes.
Okay, because I can't see any of you anymore. So I just wanted to touch base on hearing screenings just a little bit to kind of talk about why they're important and why we have the OAE screeners and why we should be using them. So to kind of lead into it, the goal is to identify and provide intervention services to children with hearing loss as early as possible, and that's the goal of what's called the Early Detection and Intervention Program, or EDI. And so when we talk about hearing screenings, there's several ages at which we like them to occur. I always think about first the universal newborn hearing screenings, which typically happen at the hospital. And these hearing screenings are useful. To give you a little bit of context, about 3 in every 1,000 children are born with hearing loss. And so that universal newborn hearing screening really does catch a lot of them. But by the time we get to age 6, that number doubles to 6 in every 1,000. So it's that those extra 3 in every 1,000 kids that we might be missing if we didn't do early childhood hearing screenings. And so that's kind of why we do that. The use of questionnaires, while helpful, doesn't always catch those kids either. So that's why on top of questionnaires and things like that to determine risk, we look at OAEs and other screening methods. And it is required by Part C and Part B to do these kind of things as part of a comprehensive evaluation so that we make sure we are assessing every piece of the child. And so this page is kind of just going over hearing screenings from birth all the way until kids graduate. Not all of this is important to you guys, but birth to 3 is when the recommended type of hearing screening is OAEs. So those OAE machines that you guys use in your birth to 3 programs. Just for some context, an early childhood preschool screening at age 3 or 4 is required before entering public school kindergarten. And there's a state statute on that. And as the kids get older, it tends to be more of the pure tone hearing screenings that happen. And this page just kind of goes through at what age they're recommended and all of that sort of stuff, but not super important for you guys. In terms of you guys, the hearing screening should be completed on every Part C referral or initial eval, every Part C to Part B transition eval, and every Part B initial eval. The only kids who do not need a hearing screening are those who have a documented hearing loss. And in that case, what should happen instead is getting documentation from the clinical audiologists stating the level and type of their hearing loss. And if you do have that, make sure to share that with your DHH team. So a DHH teacher, me directly, whoever you need to share it with. Again, I kind of reiterate here that questionnaires can be useful for additional information, but should not be used in replacement of a hearing screening. Any questions so far? Okay, so just a little bit on how OAE works. There is a video that you can watch in your own time, but the probe tip goes in the outer ear here, and it sends a signal into the middle ear space to this cochlea, where there's tiny little nerve hair cells that vibrate in response to the sound and actually send that back to the probe tip, which measures it. So if you get a pass on an OAE screening, what that tells us is that this outer and middle ear space is healthy, as well as a lot of those nerve cells in this cochlea. An OAE can miss certain types of hearing loss, such as if there's a problem with this nerve here, which carries the signals to the brain. It can also miss some types of mild hearing loss. So if you get a pass on an OAE, it's important to continue to monitor and make referrals as appropriate. Rescreening too can also help catch some of that. So when you go in to do an OAE, the supplies that you'll need are fully charged equipment, probe covers, documentation forms, and some quiet toys and distractors. I did link in here the different part numbers for reordering and who you can reorder different parts from. So if you need more probe covers or more whatever you need to make sure the equipment keeps working, this is who I would contact. So talking about OAE screenings, if you get a pass result, that is awesome. You should document it and put it in the student's file, as well as put a little bit in their evaluation. If you do get a refer result, attempt the screening again. Sometimes if the probe isn't secure in the ear or nice and tight, you won't get a pass result. It could also happen if there's excess noise in the room, so making sure the room is quiet before making a second attempt is good. If they still refer, then you want to wait 14 days and attempt the OAE again. If they still refer after that, then refer the family to their primary care physicians for some middle ear evaluation. And after anything is cleared, try it again. And if they're still failing, that's when you might want to refer to an audiologist. We are always here to give you different names of people who are in the area. And so we can make some recommendations of some really good pediatric audiologists that are around where your family might be living. So this is kind of a depiction of that protocol. So you have your first OAE screening. They pass. All right, great. You get to kind of monitor and see if there's any issues that pop up. If you refer, you wait the 14 days. Again, this is kind of what I just went over. And it also here is, while OAE is a quick, easy, and effective way to screen hearing, it does not identify all types of hearing loss. So just making sure you continue to be aware that even if they do pass their OAE, they could have a hearing loss or even develop one later on. These are just a couple of forms to use for the screening. So the first is a case history form, which you might not use. A lot of the questions might be already part of your intake, but it's helpful to kind of look over this form and see what sort of risk factors there are for hearing loss. I also have an OAE screening record. So this one is one that you can use for documentation. You can put on the child's date of birth, if it's part C or part B. All of this sort of information is on there, and then your first OAE, second, and if there's a middle ear consultation, things like that. Then let's see. So there's also, if the student is referring and you need to make a referral to their medical provider, there's a form for that as well, to let them know that they failed a screening. And there's also a form that you can send to the doctor to fill out for some more documentation. So for a middle ear consultation, and then if you need to send in for audiology. So just a couple helpful forms for you. And then we've got, this is a picture of your OAE machines. So all the districts have this same OAE, machine. And there is a video that you can also watch that walks you through how to use it and how it works. And then the last thing I like to say is just try and practice. If you're not super comfortable with your machine, you can certainly practice. I am always here, so if you want to meet with me and I can go over with you how your machine works, I am always a resource. You can reach out to me at any time. I have some strategies here that you can use to, if you are having trouble getting the OAE to work or to get a result. There's some strategies and things like that. But I always encourage you to practice on each other or on a willing staff, or you can always call me out there to practice. Does anybody have any questions?
All right. Well, Sarah, thank you. Oh, Carrie, you have one?
Sorry, I was just curious. Each district does have an OAE for ECSE specifically, correct?
I believe so.
Okay.
And that is, so that document that has the billing info and everything, I have also the serial number of each machine for each district, and Bram, Isle, Malacca, Mora, and Ogilvy each have one machine. Princeton has two. And yes, this presentation is in the agenda for that Marissa will be sharing with all of you. So you should be able to open that and click on all the links and whatever you need to do with it.
Yes. Well, that will be there. As always, please reach out, but I'll be coming around to visit as well. You can expect the agenda out shortly, and I will also be sending out the next round of survey. So I hope everyone has a great day. Let me know if you need anything.
One other thing, in terms of the calibration, I have been asked a couple of questions. One is the approximate cost, and Midwest Special Instruments has told me that it would be around $280 per machine. So Princeton, you have two machines. All the other districts, it should be around $280. The machines will be all calibrated on the 7th, so they will be ready to go at the end of the day on the 7th or on the 8th. So you'll have them back fairly quickly. We just have to figure out how to get them back to you. So just let me know if you're having any troubles with that or you need help coordinating with someone, and we'll get them back to you as soon as we can.
Awesome. All right.
Sounds good. Thank you,
Have
Sarah.
a great day, everyone. Thanks, Sarah.
Thanks, Marissa.
Bye.